Hello, everyone, and you're welcome to this episode of Precious Inspires. May is a mother's month, and so on Precious Inspires this month of May, we are focusing on the things that pertain to mothers, the things that can make mothers whole. And today on the show, we are going to be talking about maternal health, maternal mortality, and infant mortality. Joining me today is a highly respected physician with experience in maternal and neonatal health. She has been on several media outlets, including BET, HughesPost Live, and Fox 5 in New York City. And she is an assistant commissioner at the New York Department of Health and Hygiene. She will be talking to us about ways to prevent maternal and infant mortality as a whole. Hello, Dr. Aletha, and you're welcome to Precious Inspires. Hello, Dr. Aletha. Can you hear me? Hello? Hello? Are you there?
Okay. Can you see me?
Yeah, it looks like you didn't hear the introduction.
Yeah, yeah. I'm here. We can try.
Okay, let me take that all over again. You can always edit after this. Can you hear me now?
I can hear you.
Okay, good. I'll do that all over again. Okay. Hello, everyone, and you're welcome to this episode of Precious Inspires. May is the Mother's Month. It's in this month that we get to celebrate Mother's Day. So, on Precious Inspires this month, we are going to be looking at an important issue that pertains to mothers, and that is maternal health. And joining me today is a highly respected physician with expertise in maternal and neonatal health. She has been on several media outlets, including HughesPost Live, BET, and Fox 5 in New York City. She's also an assistant commissioner at the New York Department of Health and Mental Hygiene. And today she will be talking to us about ways to prevent maternal and infant mortality. Hello, Dr. Aletha, and you're most welcome to Precious Inspires.
Hello. Thank you for having me today.
Thank you for accepting this invitation to come on the show. I know a lot of women are going to learn from your expertise. Okay, I've heard experts say over and over again that a lot of pregnancy-related deaths could have been avoided if the right steps were taken. What will you say a mother can do to avoid her pregnancy, to avoid losing her baby or losing her own life because of pregnancy?
So, pregnancy and motherhood is such a valuable time in anybody's life, and it's so critical that a mom is healthy and the woman is healthy actually before she gets pregnant. And, and a lot of our conversation in health and in a lot of people's minds is that, when a woman gets pregnant, she needs to get into care and she needs to follow her doctor. And very important learning is that it's really, really important for a woman to become healthy and to be healthy before she gets pregnant, because there are so many things that influence that mother's life and the child's life before she's pregnant. And so we really encourage, the basics of ensuring that a mother eats well in a good balanced diet. And when I say that, it's kind of a lofty term, and sometimes people are confused about that. But I say just as much fruits and vegetables, greens and colors as you possibly can take in, just extremely, extremely important. Ensuring that every woman gets her folic acid, 400 milligrams or micrograms rather a day, are absolutely essential. Also, what's essential is exercise, and we know more and more that the benefits of exercise aren't just for the mom, but it also helps with the development of the baby's brain. And oftentimes we're seeing more evidence and more research that's showing that the outcomes for mom are really good when she's exercising on most days of the week. We usually say about 30 minutes, but honestly, we know that as little as 15 minutes decreases a person's mortality by 20%. So again, and these are things that we've all heard, the importance of eating well and exercising. But it really plays such a vital role in how healthy our moms are.
Okay.
And,
Yeah, go ahead.
okay. And another important factor that we don't talk about as much, and that's the impact of stress, because what we know about maternal mortality and infant mortality, both of them. And so in the United States, maternal mortality is increasing. It actually decreased. There was a 99% reduction in maternal mortality from the 1930s to the 1990s. So, it was tremendously decreasing, and that was because people were now having babies in the hospitals, there were antibiotics, people were using pain meds. But then in the 1990s, the curve started to swing up, and really for the last 2 decades, we've seen an increase in maternal mortality in the United States, which is not common for an industrialized nation. All the other industrialized nations, their maternal mortality has actually decreased. And so when we look at, moms and what is happening here, and we look at babies, who also die earlier, and we know that in the United States, communities of color, especially African American women, more likely to die from maternal mortality, almost 3 to 8 times more likely than white women to die from maternal mortality, and then for infant mortality, 2 times more likely than white women overall in the United States. And so we start to look at several other factors that could be, contributing to a woman not being able to, one, maintain health for herself, but then maintain health for her baby.
Yeah. Okay, I'd like to point to the issue of exercise. When you talk about exercise, 30 minutes, 15 minutes, will you consider the time the woman maybe takes a walk or does some chores around the house? Is that exercise, or she has to get into a routine, like maybe going to gym or something? What kind
She
of
doesn't have to,
exercise would it be? Yeah.
sure, she doesn't have to go to the gym. If you can afford the gym, then fine. The good things about a gym, it has a consistent space. Most gyms have group classes, but now they actually have affordable gyms that are in the United States that are like $20 a month or $10 a month, which is pretty inexpensive, but you kind of trade off and you don't have group exercise. And we found through evidence that group exercise really tends to work with women. We like to hang around each other, and we're very supportive of each other. And so group exercise tends to work. But if you don't have access to a gym, in many communities that are poor or lower income don't have affordable gyms, and they're not in the communities either. And so what we say is that, you can walk. Chores
Yeah.
around the house can be considered physical activity, and they are a part of physical activity, but you have to do a lot of chores, and for, a pretty long period of time so that your heart rate is sustained. It's important that your heart rate is sustained, for a good 30 minutes. That's the cardiovascular benefits. That's where you get it from, is when your heart rate is elevated for 30 minutes consistently. Because when you do chores, sometimes you stop and start, you stop and start. So there are other things, though, that you can do in your homes. If you live in a building that has stairs, we recommend, and I started doing this, you can go up a few flights, and then you can take the elevator the rest of the way if you want. And then every day you can increase the amount of flights of stairs that you go up as well as that you come down. We call this, really incorporating, this is more kind of your your non-planned physical activity, and kind of what you have incorporated into your day-to-day basis. If you can walk to work, if you have the ability to do that, try to walk to work or walk to a certain point and then get on the bus and get on public transportation if you haven't been walking before. They also have, in parks, utilize parks and other open spaces in which you can also, walk around or play games. If you have children, play with your children. They're running all over the place, and their heart rates are up all the time. And so sometimes it's kind of good to follow around them to keep ourselves active. But that consistency is extremely important on an almost daily basis, and then also for a period of time in which your heart rate is consistently up for about 30 minutes. But there are many creative things that one can do, and I really suggest doing it with a buddy, and holding each other accountable, and saying, hey, it's time to, even when you don't want to, but it's time to get up and go for our exercise class, or it's just time to go and walk around the block 3 times. And you can incorporate those things little by little in your day.
Yeah. Well, you mentioned African American women being more likely to die in pregnancy than the whites. Is there any cause that has been attributed to this?
Right. So there are several things that people are pointing to, and we don't have an exact cause. We don't have an exact reason, but there is evidence that points to several things. So one, there is the basic thing that I mentioned even before. So women, I'm sorry, excuse me. Women who are of color tend to be disproportionately represented in communities that are poor. So we know communities that are poor tend to have several things that prevent them, or the situation is just not set up so that it's as easy to be healthy. So remember I said earlier it's important for the woman to be healthy before she becomes pregnant. But what do you do when your environment doesn't really support you being healthy? So as an example, in some of our communities in the cities, there isn't great access to fruits and vegetables. There are these huge supermarkets that are present in some of our suburban neighborhoods. Or even in New York City, some neighborhoods have a lot of supermarkets and some neighborhoods don't. And a lot of our poor communities and communities of color don't have as many supermarkets. And so you're less likely to have access and less likely to have these things in your face that are accessible as far as whole fruits and vegetables so that you can eat. That's one challenge. The other challenge, and I said about physical fitness and physical activity, a lot of our communities have high rates of crime.
Yeah.
And so oftentimes parents and moms don't feel comfortable sending their daughters out, or they don't feel comfortable walking and navigating in their communities, whether the crime is actually happening or not happening. So that's a barrier. And so there are all these other social determinants of health, and so you think of income, and jobs, and if somebody has a job or not. If somebody has a high quality education, we know that education is one of the greatest protective factors for somebody's health. The higher your education, the more likely you are to be healthy.
That's
Same
true.
with, and housing. Housing is also very important. But when you go into communities that are low income and predominantly of color, a lot of these situations and areas are challenged. So it's really difficult for the woman to be as optimally healthy as she could be compared to other communities. But the other thing that, I think ties into it, 2 other things actually, are one, the quality of health care. Maternal mortality is really an issue of human rights, I believe. And it's an idea that, a woman has the right to be free from discrimination, and she has the right to have, health and quality of health care. And maternal mortality is one of the greatest markers for a nation's health. And so if we really look at what's happening, we have to look at our systems of health care. And are they providing our women what they need? And especially in communities of color. And so, oftentimes some of the delays, and I call it the 3 Ds, are a delay in seeking care. So oftentimes the women, for all those other reasons that I mentioned before, because they have all these other things going in life, they may delay care. So say they have their baby, they deliver, they go home, they feel something's not quite right, but they may delay their care from going into hospital and following up. They may not be able to get to care because in some situations they don't have transportation to get to care. It's a key barrier in many communities. Not so much here in New York City, but in other places. And then the other thing is there are delays in response to care. So a woman will go into the healthcare system, but they're on to the needs that she has at that time. They're not listening to what she's saying, and then sometimes she'll get sent home and the diagnosis isn't right. And so there are things that are in our health system that need to be looked at, and they need to be analyzed, and we need to make sure that we're being culturally appropriate to our mothers, that we are coordinating care so that we're not missing things and missing situations that are happening. And we need to just build up our system so that they support mothers at all given aspects, whether she's home in her community or whether she's in the hospital or even when she's at work.
Wow. From what you said, I know that maternal health is it's a combination of different factors. It's not just going to the hospital and seeing a doctor, but the environment matters, the economic situation matters. Yeah, in Africa
Yes,
where I come from, I've seen a lot of mothers die in childbirth, and people often attribute
yes,
this to witchcraft. It's with knowledge that we come to understand that there are a lot of things that if they had been put in place, these women wouldn't have died. So that's really enlightening.
right.
Before we continue our conversation, I just want to remind our viewers that you're watching Precious Inspires on Sylvia Global Media Network, and I'm speaking with Dr. Aletha Maybank, who is talking to us about maternal and infant mortality. Okay, Dr. Aletha, I'd like us to talk now about the infant mortality. Let's go to miscarriage. A lot of women, after miscarrying their babies, blame themselves for it. What are the things that actually lead to a miscarriage? Is it really, do miscarriages, especially in the first trimester of pregnancy, is it a result of rigorous physical activity? Is it something that the woman did or did not do? What is the cause of miscarriages?
Well, I think miscarriage. I mean, there are several reasons why a woman could miscarriage. There are genetic reasons why a woman could miscarriage, and the baby just wasn't viable. As stressors and factors that are happening in her life that just weren't going to support the baby from being born. And then there's also reasons for and sperm sometimes is not exactly adequate, or it doesn't quite create a situation in which conception has worked well. So there are multiple reasons for why a woman rather could possibly miscarriage or miscarry rather. I think when we think about infant mortality, though, we're thinking about infant mortality, and the definition of that really is the death of an infant before their first birthday. So after their birth to up to their first birthday. That's what we consider to be infant mortality. So it's a long time
Okay,
period.
okay.
Um,
Sorry, let me just come in there. So are you saying miscarriage is different from infant mortality?
yeah, miscarriage, yes. Yes, I am. Because infant mortality happens after the baby is born.
Sure. Yeah.
Miscarriage is
Okay.
while the mother is still pregnant.
Okay. Okay. Good. Yeah.
And so, infant mortality, when we look at that, again, we have a situation where African American women are more times likely to die. I mean, what's different, though, about infant mortality than maternal mortality, remember I said maternal mortality was on the rise in the country, and part of that reason is because women are also having babies that are older. I didn't mention that. So that's another important factor of why maternal mortality may be going up in this country. But when we look at infant mortality, it's actually going down. Babies are living better now than they have ever before. However, there still is this gap that exists. There's still a difference between communities of color and white communities, and especially for African American babies. And some of the reasons, the main big reason is that babies are born too soon. So prematurity is usually the greatest risk factor for infant mortality. And so the question is, so why are babies then being born early? And why are moms delivering early? And it's very similar to what I mentioned for maternal mortality. factors related to, again, we're fighting about the woman's health. You know, obesity, especially in communities of color, we have communities where 50% of the moms are either overweight or obese, and that has tremendous consequence on the outcomes of a baby. And then again, it's just not having that supportive care, especially in low-income communities. I think we really undervalue when we have access to support, and when we have families, and we have health insurance, and we have people around us who are checking in on us. That's so important to how successful we are in life in general, but especially during a time when a woman's pregnant. And so you could imagine, a woman who is in a community, in a lower income community, who is, doing so many different things, and especially if she doesn't have a co-parent, or a partner in the home, and she's working all the time, and she has other kids. There are so many other stressors that are happening in her life that, again, are preventing her from taking care of herself optimally. And that impacts on babies when they're born, and for them to be born early. Another risk factor, and this month is also Safe Sleep Month for babies here in the United States. And so we know that there are sleep-related injuries, as well as SIDS, sudden infant death syndrome. SIDS is not very well explained. We're not quite clear exactly why it happens. They'll do an autopsy, and they just can't really find a reason of why this baby died. And usually happens between the ages of 1 to 4 months old. But you're not quite sure why the baby died. But we do feel like there's a risk factor of, and so we had this huge 20 years ago launched the Back to Sleep campaign. So, it's encouraged, well, not even encouraged, pediatricians, the recommendation, the guideline is all babies should be put on their back to go to sleep. They should not be on their bellies to go to sleep. They can have tummy time during the day or while you're up with them and you're playing, but while they're in sleep, they should be on their back. And then also in the crib, there should be nothing in the crib. We say no blankets, no pillows, no bumpers, no toys, nothing in the crib but a sheet and the baby and the sleeper that the baby is in. Because there are many times when if something falls over the baby's mouth, they don't really have the ability to move something out of the way, and so it can actually suffocate them. And then and we want to not have that happen. And so that's a sleep-related injury. The other cause of a sleep-related injury that happens in many places, not just in the United States, but all across the world, is bed sharing. So sleeping in the same bed with your baby. And we really highly discourage that because, again, and a lot of parents, and I'll hear moms, and I have friends who say this, well, I'll wake up when the baby turns over, I'll wake up, or not turns over, when the baby moves, I'll wake up. But the reality is, yes, there's a strong possibility that that will happen, but at the same time, it may not. And so there are cases where, unintentionally, moms or whomever sleeping with the baby, parents, siblings, have suffocated the baby during their sleep. Pets, the same thing. And so we really discourage bed sharing. We say you can co-sleep, so you can have, a crib or whatever, safe sleep environment or bassinet or anything that's approved, that you can have that in the bedroom, but not having the baby in the bed. But you can have the baby in the bedroom, and we think it's good to have the baby in the bedroom, actually in a bassinet or crib. It's actually protective because then you're just closer to the baby. But again, these are some of the factors that cause infant mortality. And then there are also just birth defects that happen that cause infant mortality as well.
Yeah. Okay. We see some mothers having children at very short intervals. You could find some kids. The older brother is 2 years old and the younger one is 1 year and some months. They are just some months apart. I'd like to find out if this kind of child spacing is dangerous to the health of the mother or the health of the child.
I don't know what the stats are for that particular question, but I know that birth spacing is important. It's important for the health of the mother and health of the child, but also for the development of the child. But there are many situations in which babies are born pretty closely, one next to the other, but I don't have the stats for that right in front of me, to be able to indicate that to you. But we do know birth spacing is important, and the longer that you can create that birth space, and the more time you can allow your body to heal from having a baby, and the more time you can give to that child as well and have focus, the better we believe that is.
Sure. Um, okay. I'd like to also know if a C-section or vaginal birth, does having
Well,
one a particular kind of birth make maternal mortality more likely? Is it more likely to die while having a C-section than while having a vaginal birth? Or
Well, I mean, C-sections increase the risk of other complications. Maybe not necessarily mortality, but definitely having other complications. So we call it morbidity. So, complications related to infection and things of that nature, having pulmonary embolism. Does it mean that it's going to happen? Absolutely not, but it can definitely increase the risk. Pregnancy increases the risk alone for these types of things as well. But we do know and we do believe that cesarean births, we know that they have increased. Almost 1/3 of births in 2009 were cesarean sections, were C-sections, and we believe that might be a reason for the increase in maternal mortality, because it does increase the risk. But and so that's kind of, the teaching points. And now we're seeing, more of an effort, at least here, by our professional organizations, ACOG, which is the obstetrician organization here in the United States, the professional organization, really looking at their practices and really encouraging, folks and doctors and providers not to use C-section, as just a voluntary, procedure. That if a mother can deliver a baby vaginally, that's the optimal situation to have. And so one of the ways in which we work with mothers, because this is really important, especially in low-income communities, is how do we get mothers to advocate for what it is that they feel is best, for them. Now, granted, it's more of a team conversation, with the provider and the mom. And so there's not this power, divide where the provider is saying everything and this is how it's going to be done, but the mom is able to kind of incorporate like what she's feeling and what she knows is best, and allowing her the patience to deliver a baby vaginally. And that many times requires, a conversation, teaching around advocacy tools, and teaching moms how best to use their voice and how to best speak up. Because we know in, again, low-income communities of color, that people don't feel as empowered to use their voice. They may know and have a sense that something isn't quite right, but because they've always been in situations in which they just haven't had that power, where if they did speak up, they felt nobody listened, or they felt nobody listened, it's harder for them to speak up. And this is across the country, and this is more now kind of a woman's right issue, of a woman being able to use her voice, know her body, and use her voice to express what she feels is best for herself and her baby. And so some of the programs that we have are, as an example, are like doula programs. So doula programs are birthing assistant programs. So we have folks who will go and visit mom 2 times before she gets pregnant, speak with her about the importance of breastfeeding, which is another big important thing for moms to do. It's the natural thing to do. But breastfeeding, how is she doing, feeling mentally and stress-wise, what's going on in her life. Is she going to her doctors for her visits? How are they going? That's before the visit. And then they actually sit in the hospital during delivery. And evidence has shown, and ACOG just released a huge statement 2 months ago, that now they recommend having birthing assistants in hospitals, to sit along with providers and with doctors that will help with the women and help their delivery outcomes, because delivery outcomes tend to be better when doulas are present. So they'll do 2 visits before, 1 during the delivery, and then 2 after, to follow up with mom to make sure, 1, she's breastfeeding, but 2, to see how she's feeling and how is it going. And it's not just the visits. There are a lot of intermittent phone calls, and if mom has any questions, she's able to reach out and ask this doula for some support. and the doula will help link, whatever she needs. Is this everywhere? Absolutely not. But, we're trying to figure out how do you create more of a wraparound system so that mom has support in many different places.
Okay. Well, I have two kids and I exclusively breastfed both of them, and I know the benefits breastfeeding has for a mother. So I really encourage all the mothers out there to breastfeed their kids. Okay, Dr. Aletha,
Yes. Now,
I'll, yeah. Lastly, yeah, go ahead. Go
No, I
ahead.
was saying, it's fine. I was just saying, breastfeeding can be you're absolutely right, and there's no one better to hear it from than I believe a mother. But it's
Sure.
challenging, and it's challenging because again, the workplace doesn't support it. There are
Sure.
now laws, fortunately, that now require employers to have spaces for moms to pump if they choose to pump. There's, law moms, at least in New York State, moms can breastfeed absolutely anywhere they want to breastfeed, but we still now have to kind of get the community and cultures to support and understand that breastfeeding, especially in communities of color, that breastfeeding is okay, it's natural, not to sexualize our breasts, but they're
Yeah.
actually on our body for a purpose, and that's to feed our babies.
Yeah, in Africa, you find women breastfeeding like everywhere, in public, in the
Right.
bus, everywhere. But since I came into the United States, a few months back, I've never seen a woman breastfeeding in public. So it's like there's a
Yeah,
stigma attached to it, and that's
absolutely.
sad.
It's hard. It's how do we change the culture? And so that's some of the work that I do is how do we work to change social norms and understanding, and not just working with moms, working with the grandmoms, working with fathers, working with men, of everybody to say that this is a normal thing to do. It's okay. That's what our bodies are made to do. So
Maybe I'll go. Excuse me. Okay. I want to show. Sorry. Okay. Um, I was going to ask you to share with us the most common maternal health issues you've encountered during your career.
I mean, common, I would say, um, I guess because I used to work in a neonatal intensive care unit. I would say in the NICU with the tiny babies that are usually born early or something is wrong with them. Again, because so much of what I do is around communities of color and low-income communities, I just feel a lot of the issues have to do with support um, and having and just providing moms with the support that they need, and for moms to have places where they can reach out to for support and to know that they can reach out to get support in various avenues, whether it's their healthcare center or whether it's their a local um, community-based organization that's doing this kind of work, or a faith-based institution. We're working with a lot of churches and we're working with mosques and synagogues to actually create spaces so that there are resources for women to learn about how to best take care of themselves as well as to breastfeed. And we're encouraging the institutions, the faith institutions, to really open their spaces up and allow women to breastfeed.
Okay. I would like to note this quote from Amnesty International, which says that around the world, one woman dies every 90 seconds in pregnancy or childbirth, and the vast majority of these deaths are preventable. So, women out there, if you take the right steps, follow what we've learned from our guest today, surely you're going to prevent being a victim to this kind of death. Thank you so much, Dr. Aletha, for coming on the show and sharing with us.
You're welcome. You're
I've
welcome.
personally learned so much.
Good.
And thank you, dear viewers, for watching. Thank you, Sylvia Global Media Network, for this opportunity. And all the women out there, take good care of yourself. Enjoy this Mother's Month and have a great time. See you next time. Bye.